Hello, everyone, and welcome to the gener8tor Founder Series Spotlight. I'm Troy Vossler, co-founder at gener8tor, and I'm joined today by the co-founders of Greens Health, Kehlin and Isis. Welcome, both of you.
Welcome, welcome. Happy to be here.
Well, let's get started. I would love for each of you to introduce yourselves as well as the company. Tell us what Greens Health is and what it does.
Yeah, I can go first. My name is Isis Ashford. I'm the co-founder and COO of Greens Health, and we are a chronic care management program focusing on patients 65 and older and keeping them out of the hospital. And so we offer four lines of service from traditional chronic care management, but this is specifically towards low access, low resource patients who may not understand all of the education being provided to them in their primary care visit. But we have to also appreciate it's only 15 minutes. With us, you get 2 hours. And so we translate everything from why you should be taking your medication, what are the benefits, and also documenting any symptoms that we can kick back to your primary care provider to handle any type of adjustments. We do care coordination for facilitating housing, transportation, social support, as well as food insecurity. We also practice food as medicine programs, as well as remote patient monitoring. So sending devices to patients. So in between visits, if there's any hiccups, our team will catch them. We will call you within 10 to 15 minutes to de-escalate the situation or redirect you to an urgent care ER to get that taken care of. And so we're pretty passionate about the community that we serve. And we want everyone to have the same experience that our family had in receiving better quality care management, if you will.
Yeah, one tagliner is all about turning spikes in blood pressure and blood sugar to smooth levels. And so on this call, we just got an alert that some blood pressure has spiked and on our platform. And so now the nurse, Naji, will go out and reach out to the patient and see if they need assistance either via telephone, text messaging, or the mobile application. And so just to give you a quick example, but I'm Keelan, the co-founder. We actually met in engineering school, both of us engineering at Prairie View, which is a small rural town in Texas. And
I'm the better engineer, by the way, if he was
yeah,
wondering.
yeah, it started off as just an engineering project, to be honest with you, and seeing if we can like change people's behaviors just from a mobile device, and then just expanded into Medicare, reimbursements, business model, growth, and traction. And so that's a little bit about our background and how how we see the world and how we plan to make change.
I love it. That's a cool backstory as well. Um, what's the current status of the company? Like, however you want to articulate that. Maybe it's traction or revenue or customers or investment.
Yeah.
Where do you consider the current status and traction of the company?
Yeah, I would say we're at the pre-seed stage, right? Most notable investors have come from grant institutions, federal institutions like the National Science Foundation. We are a SBR company. And we recently got a grant from the NIH too. So that's where a lot of the IP and clinical design is done. But we also are funded by gener8tor, and Innovate Alabama, right? And we'll get into that later. And as well as Blue Cross Blue Shield Alabama. And so I think we're starting off with on a good start from the fundraising lens, and we do have some notable customers as well.
Yep. So we started off in type 1 diabetes, first customer being Camp Harris, the best diabetes camp in the world, if you ask me. Absolutely love the guys over there facilitating such beautiful programs. If you ever want to get a glimpse of what true humanity looks like, participate, volunteer. Absolutely love it. Can't say more great or better things about it. Another notable customer was Children's of Alabama. And since then, we have now transitioned into more of the adult chronic care market. And we're focusing on our primary customer being Nation's Healthcare Specialist, which is a home health provider.
Nice. Congrats on all that traction. And then where is the company located?
We are located in the beautiful city of Birmingham, Alabama.
Nice. And why, when you think of like why Alabama or why Birmingham, what comes to mind?
Well, because we're in chronic care management, like pretty much the majority of Southeast, they call it the diabetes belt. or heart attack belt. And so I mean, for us, if we want to make true impact, or it's relatively easy for us to make impact is the thesis in a place where the occurrence is so high of these conditions. And then secondly, um, the partner institutions here also see the problem, like the largest Medicare provider insurance plan, Blue Cross Blue Shield. The state resources are all around changing the healthcare of Birmingham, and specifically Birmingham is sort of its own medical center where they have the largest employer of the
Right,
one of the largest
UAB.
of the employer of the state of Alabama called UAB, University of Alabama in Birmingham, not Tuscaloosa, where you see the roll ties and the footballers going. But so there it was multiple factors of Birmingham from healthcare standpoint, funding resource standpoint, and just initiatives to make someone from Texas say, hey, this state looks like it's better than Alabama for us to grow and for us to grow and nourish our
If
on the startup.
if I could add to the community in Birmingham. I think we're originally from Houston, Texas, and so we are very proud Texans. However, the community in Birmingham, whether you are in at an institution or you are a regular, bystander, everyone is willing to connect you, to speak with you, to brainstorm with you, to support you, advocate for you. And it was a little, kind of weird. Because again, we're used to Southern hospitality, but not in the sense that this is only our second time meeting, and the level of advocacy that we've seen here has been incredible. And so I feel like everyone is on the same page as far as wanting Birmingham to grow and thrive. And so we're super blessed and honored to be a part of that same community and with the opportunity to even contribute to that community and increasing better healthcare and quality care for the patients and population here.
I heard a couple names, so definitely a shout out to UAB and Blue Cross Blue Shield and Innovate Alabama, and just part of the reasons why having your startup in Birmingham and in Alabama is successful. Um, Remind us, which generator program did you go through and when,
Oh,
and then
that
tell
makes
us
sense too.
about that generator experience.
It was called Prosper HealthTech. So Prosper is a nonprofit that won they did they won a lot of tax incentives, which is the economic development program of Alabama that, funded the Health Tech Accelerator. I think they're on cohort 7, but we're in cohort like 3. And so, out of all the generator programs, there aren't too many that was focused on health technology. Like that's the domain, that's the specific focus. Maybe there's maybe one or two more. And so the cohort was very, very, for us, we was learning, as you've seen, we pivot over time, which is the part of the startup process. We was like coming in with some technology we built with a government grant and learning how to uh, attract customers, or what is our business model, or what will be our go-to-market. We had over 3 different go-to-markets coming into Generator and going through the accelerator process of Prosper. We ended up landing into one field. Um, and I think that was a huge learning curve for us. So instead of taking a year, I think the pitch, you figure out where you need to go in 12 months.
12
So you
weeks.
can, 12 weeks, so you
Mhm.
can focus and dial in. So I would say that's a huge value proposition. Of course, that's a financial resource as well to extend your runway with the pre-seed investment. And I think in our cohort, they don't do this anymore, but we were one of the top 2 companies in our cohort, and we got the follow-on funding as well. And so that was some key, like high-level principle takeaways that I've experienced from the Generator program, Prosper Health Tech Accelerator specifically. What about yourself?
Yeah, I think Prosper is such a prominent nonprofit in the area where what's really convenient is anybody you should be connected to is on their board. And the team is so generous with connections. I cannot echo this enough. The community here really wants to figure out how we can embed innovation in
Mm.
every aspect and every service that they offer. And so the team at Prosper Health has been really incredible in helping us figure out how to, pitch these conversations. What are the motivations? What are the interests? And since 2022, since we participated in the program, it's been consistent in communication. It's been consistent in advocacy. And yeah, I think Birmingham, Prosper, gener8tor has been super influential in our growth.
Yeah, definitely shout out to JW Carpenter and the crew at Prosper and just the tremendous network. I think the example you gave of, they just have such a tremendous board comprised of all the major, players and decision makers and how that can support, your startup and entrepreneurial journey as well.
Mhm.
Um, what advice do you have for entrepreneurs or founders considering an accelerator program?
Yeah, my advice would be come in with your 1 to 3 goals that you want to accomplish within 12 weeks. So then the team, the supporting staff, I think it's Amanda and Kelly currently at Prosper HealthTech Accelerator. They can connect you, put you in the right rooms or connect you with the right people or ask people that may be on the board or in their network, hey, can you help out with such and such challenge? And they also bring in service providers too, right, that they consult with. So like the service providers would know, hey, this group needs to understand first when healthcare. So everything's like reimbursements and billing. This group needs to understand like their billing process. So like, have 1 to 3, not 10, because focus is going to be key to accelerate the progress in next in your 12 or 16 weeks of the program. And then the second area will be just open to connecting. There's so many, I call them random events or random meetings at accelerators have, but especially networking, it's a good chance, they're telling you come to a networking event for a reason. And like I still don't know all the board members, or I still don't know all the key players. And so just showing up, putting yourself in the right room can pay dividends over the lifetime of the startup. So those are my two.
Yeah, for me, I would say my advice is unreasonable because I can only imagine if I pitched this to myself, I would be like, yeah, right, okay, whatever. But one thing, I know Kehlin mentioned like two, three things, and I think, yeah, if you have a large team, but if it's just you, it's just, two other people, what is the one thing? And it's typically around four items. Shout out to my mentor, Christopher Francisco, for helping me create these buckets. It's either creating more traction, raising money with investors, working on product, or team, and we'll say operational efficiency. I would zone in on one thing though. And if you don't have as much traction as you would like, then or yeah, if you don't have as much traction as you would like, I would focus on that because that's the way that you do get the investment, right? And even if it's product led and you want to build out your MVP, make sure you're talking to customers and they're super, embedded in that development process. And so you're building something that they will actually use and you're not building in a silo. And I think that's one of the wonderful tips that we got from gener8tor. And so as we were doing our product development, we were working very closely with Cam Still Harris, showing them our prototype and our screens. And they were like, I like that, hate this, let's change this. And this is how this will work in this setting. And it was super fruitful in our first pilot.
All really good advice. I appreciate it. Um, Tell me about your favorite part of the program or perhaps the favorite connection made either during the program or sometime after the program.
That's tough. That is so tough.
I may have one. Um, I would say one of my favorite connections during the program was actually a connection at Blue Cross Blue Shield. Her name is Tara Talley.
That was good. That's good.
She was, I mean, she like 6 months after the program, she continued to connect with us. And there wasn't a ton of financial like rewards from that connection besides mentoring and advice. She was one of the leads for the point of contact, the leads for Blue Cross Blue Shield Alabama. as the intermediary between us and their services or their, plans, um, insurance plan specific details. And so, I mean, she saw something in us. I think we resonated with her, but we met with her for lunch, met with her for dinner. I think she's only scheduled to meet with the startups like 2 or 3 times, but we probably met with her 10 times, right? And I would say that probably helped us uh, really get on the insight of like what information do we need to have at the earliest stage to like win over a strategic investor. That wasn't even her department. She just said, "Hey, I've been working with this startup. I've been seeing their progress, and I think your due diligence team should take it seriously." And so, a lot of what we do is sales to customers, sales to investors, sales to potential partners. And the best sale come from word of mouth of someone else saying like, "Oh, this is a good product," or "This is a good team."
Internal
I think
champion.
you should, have a meeting or take them seriously or dot, answer the email, whatever that may be. And so, and that was really unexpected on our end. So I would say that, that partner from the BCBS was one of the probably the going through the program.
Yeah, love, love, love Tara. My favorite connection was actually, I think the thing that's really beautiful about Birmingham is that there's so many different community events. We went to a community event and we were able to make a connection with Tamika Holmes, who runs a CCDN. And I hate that I can't remember the acronyms, but it's an incredible nonprofit that operates the mobile market here in Birmingham for folks that live in food deserts and may not have access to fresh fruits and vegetables. She goes to their neighborhood and she's able to disseminate all of those fresh goods, as well as provide workforce development, additional tutoring and training resources, and even resources for mothers in need. And so I think one of the things I learned from Tamika was what does impact look like up close and personal, and how this, seeming like a very small kind of effort can really have like this, generational impact, and for how long she's been doing it, and to see people that she's serving coming back as volunteers was like, oh my God, this is incredible. And so just creating, this constant engine of giving was really incredible. And I've been able to make some really great friendships from the folks on that team that are also very entrepreneurial. And we talk a lot about how entrepreneurial the journey is very lonely. And so to find people that you have alignment and impact, and you also have, the same business acumen, was really great for me personally, but also professionally.
No, those are great, really good examples. The last question I ask in each of these interviews is if you had just one ask for this audience, what would it be? So that could be, hey, we're looking for an introduction to this customer. We want to talk to this mentor. We'd love to talk to this investor, or maybe it's just a general question or advice that you're seeking. What would be the ask that you have for this audience? You can each do it.
Okay, perfect. So for me, and it always goes down to like what department are you operating in? I do mostly sales and business development. So I really, really love my home health providers. I feel like we can provide a lot of mutual benefit if you are a physician owned or a nurse practitioner owned or a physician assistant owned home health provider that goes into patients' homes to service them. We would love to partner with you for chronic care management. We can be your eyes in the sky, and to also alert you to any other patients that need special attention. But again, we're in alignment with averting those ER visits. And so we have a lot more touch points, and so do they. And any home health providers or physician owned clinics that are want to provide that level of service or care to their patients would love to partner with you.
Yeah, and I would say on just the fundraising side, tech-enabled investors, healthcare investors. Um, I guess our market, that's one thing we learned in Generator is different, like SaaS or, life science. And we found a type of investors, specifically that's called tech enabled, like tech enabled services. And so, people who invest in the Teledocs or the Livongo or those type of deals, we're definitely open, interested in engaging with you, whether it's from a grant or a equity perspective, or, whatever type of advice or resources you want to offer. That would be the ask for us.
Awesome. Well, thank you so much for your time, Isis and Keelan, co-founders of Greens Health. Make sure to check out the link in the description. Check out their website. And if you have any information or follow-ups based on those asks, please put that in the comments or reach out to me and we can make the connection. So thanks again and best of luck with Greens Health and take care, everyone. Bye now.
Thanks.